Officials in Texas are taking steps to reopen parts of the state this week.
Stores. Many opened up their doors to customers today.
I think it's a good thing for the economy, obviously.
Besides the decline in numbers, what makes you confident that Texas is ready to be up and running, but with precautions, of course?
They're done so in a way that will prevent or slow the spread of the coronavirus.
So good morning. We're going to go ahead and get started with our morning briefing. Again, thank you guys for coming out. So with that, if there are no questions for me, I'll turn it over to Charlene and Tony. So good morning. Welcome again. To those of you who are new, welcome to the Houston Health Department. Today, much like yesterday, we'll go through the school with the two new individuals. We'll pull off to the other room over here.
The plan is to get through about 300 by Saturday, and we're helping facilities be like a resource. We are providing them with tools and resources within the city. If they do have COVID, we want to hear about what their plan is. If they know that they have to, report to the health department, we're asking them to show us what kind of supplies they have, and if they have adequate supplies to take them through. We're helping them plan like isolation units, entrance, exits, and it's good that we have the firefighters with us because those are some of the things they're also helping us look at.
As firefighters, we visit these facilities frequently. We're familiar with how they're run, the staffing levels, and then we want to make sure that not only are they trying to provide a safe space for COVID patients in response, but they're also maintaining safety for fire exits and entrances, and the people are comfortable and happy.
We're the first time we've ever, a health department and fire department have this kind of like a cross train. We make these facilities quite often, either for the sick patients that are here, or 911 calls for the smoke alarms that go off. So at this point, we're kind of learning from each other, and this helps to prevent some of the COVID-19 issues that are occurring across the country, and it also educates everyone.
Working with the health department allows us to have multiple viewpoints to share ideas and build off of it. One of the main things we're doing is creating an awareness. So we realize that some people are not able to do everything 100%, but we want them to start thinking forward as if this would happen, what can we do next?
I met with the executive director today, so he was very good. We sat down with for about an hour, I think. We were in there. We talked about his preparedness for COVID, what kind of units they had planned out for isolation, if they had supplies, cleaning supplies, PPE for staff to wear if they did have an outbreak. And overall, we were very impressed with the things that we saw. He's gone ahead, above and beyond the recommendations. They're screening 3 times per shift. Most people are doing one time per shift, 3 times a day. He's doing about 9 times, screening staff and residents 9 times a day. So this is one of the model facilities we've actually been to this week. And so we're just talking about how prepared they were for this. And so if this should come in here, they're ready to tackle COVID-19 here.
They're pretty prepared for this. I don't know how, but they are definitely on top of it. They've even gone so far as to have the residents, as the spacing goes,
6 feet.
6 feet when they're eating dinner or breakfast. They have their names, so they know exactly who's sitting where, and the spacing is they did a heck of a job.
Getting a different department within Houston, we both have different functions. When you bring our knowledge and our background together, we're much more effectively able to assist and help these individuals in these situations, in these homes, kind of deal with something that's coming ahead. The perspective we have from the fire department is the 911 service and dealing with the patients, whereas the health department's much more focused on the spread of disease, and maintaining a clean environment. So with our two perspectives together, this has been a wonderful collaboration. I think it's going to help our community out a lot.
Yeah, because if it comes back, now we're all prepared. Health department, fire department. So it makes it probably the best collaboration that the city has done.
And I think for us, in addition to that, it does mean that we're building capacity. So within the health department as well, we've had about 20 epidemiologists consistently, just because we've never had this type of outbreak before. This is a pandemic at this point. It's new for everyone. But we're building these collaborations, and so in the future is one of those things where now we have additional capacity, and then the fire department can kind of tackle that even outside of us. So that's one of the very beautiful things about this collaboration, is additional capacity in addition to what we have.